Thankfully, we are in a comparative lull with SARS-CoV-2, as we have been every April for the last few years here, and this is a good thing. But just as before, it does not mean to let our guard down because there is still quite a bit of SARS-CoV-2 circulating. And with the dropping of so many precautions and provisions, we are still seeing cases, we're still seeing outbreaks, and even in a lull, too many people are being hospitalized. Too many are still dying, over 1,000 people weekly in the United States alone. And of course, we would be wise to prepare for increases over the coming months. We are still learning about the effects of repeat infection, and we're still learning about post-COVID events and long COVID as well. What we do know is that if you caught COVID once and did fine, that is not a guarantee about the next time. So if you'd like to avoid a potential bad outcome or potential post-COVID or long-term effects for yourself and others around you, please do what you can to avoid getting infected or reinfected or spreading it to others. Gathering outdoors is always safer than indoors. If you will be gathering indoors, make efforts to improve indoor air quality, like adding HEPA filtration units, keeping central air running with a MERV 13 or higher filter, opening doors or windows. If you must spend time indoors with others, especially members of the public, wear a high quality filtration mask like an N95, a KN95, or a KF94, and limit your time in those high-risk settings. Consider using rapid tests for pre-event testing. If you get exposed or if you have symptoms, conduct a rapid test every day or two while continuing to wear a filtration mask around others. If you or someone you spend time with unmasked would be treated for COVID, go ahead and get the more definitive PCR test as soon as possible to facilitate timely treatment. Remember, in general, you only have 5 days to start treatment, and the sooner the better. We could reduce COVID hospitalizations and deaths significantly if everyone who is eligible got treated. Please don't show up to work or school feeling sick and exposing others. Staying home and resting is best. If you absolutely must go out, a well-fitted N95 mask could keep you from sickening or even killing another person. If you're positive, please do an antigen test to exit isolation. In general, we believe that enough virus to detect is enough virus to infect. Also, please don't push yourself. Try to allow yourself the time you need to fully recover. And as always, remember to eat a balanced diet, incorporate fresh fruits and vegetables, avoid sugary drinks, consider a multivitamin supplement, get your blood pressure checked, your baseline labs checked, like your sugar, cholesterol, and vitamin D. Get some regular physical activity unless you're sick. In that case, please get your rest. Manage your stress levels and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us, and we'll see you again next Tuesday at 10 a.m.